Welcome back to SWGA Sickle Cell Awareness YouTube channel. I'm your patient advocate, Monica, and today's video is going to be about the importance of a women's health fair. And the first thing I'm going to do is talk about how it's important for women to take care of themselves. We live very busy lives. And as a patient advocate, sometimes I don't take care of myself. I'm guilty of that. But one of the things I'm going to do while I talk to you about the importance of a women's health fair is I'm going to show you what are the things I do to pamper myself. And I've already cleansed my skin and toned my skin. So what I'm going to do is apply an advanced aging skincare product. And the name of this product is Artistry's Signature Select Firming Mask. It's something I do twice a week. I make sure I take care of my skin and take care of my inside as well as my outside. And as you can tell, I've been using this a lot. This is something I do twice a week. I usually do it on Sundays or Wednesdays, or Sunday and Wednesdays. And this is a nice mask. I always start on my neck first. But while I'm doing this, I want to talk about how we as women, we're very busy. We are very, very busy. And sometimes even I don't take the time to take care of my skin like I should. Make sure I take care of myself like I should, because sometimes I'm so focused on other people, especially when I get that call, Monica, I'm in the hospital and I need you to come out here and talk to my medical team, or I need you to come out here and help me understand what's going on. So that is very important. And we know that October is Breast Cancer Awareness Month, and they have what is called a buddy check kind of program. A lot of places do. As a woman can find another woman, partner up with another woman where you do your monthly self-breast exams, which is very important. And early detection is very, very key to breast cancer. The early detection and knowing your family history. Is there any other woman or man? Because now we know that Beyonce's father has been diagnosed with breast cancer, and he's talked to his daughters about it. So is there anyone else in your family that has breast cancer or any form of cancer? And having sickle cell is not something that you get on your own. That's something that's inherited. Because sickle cell is an inherited blood disorder. And I'm doing this video also because oncologists, women that have breast cancer, they see oncologists and hematologists. Sickle cell patients see oncologists and hematologists to make sure that their pain crisis or whatever crisis they're going through is under control. And when it's not under control, they have to seek professional help. And I think that is so important. I'm not going to keep this on the whole 10 minutes. I'm going to keep it on the whole 10 minutes. I'm just not going to record the whole 10 minutes. And I like that at this health fair that they're going to have free screenings. And one of the things that I think is important for everyone is make sure they do the flu, get the flu vaccination. I know every sickle cell patient has a CDC doctor, which is the Center for Disease Control doctor, and they're the ones that manage their whatever they're going through and make sure they stay current on their vaccinations. Make sure you get your diabetes screening. They're also going to be diabetes screening at the health fair. And I think that's very important because you want to manage that. If diabetes isn't managed well, one of the things I do know that occurs is that patients go into what they call a diabetic coma because it's not managed very well. So you want to make sure you're managing that. Especially if you're not eating right, I highly recommend that you take the medications that have been prescribed for you and make sure that you do that and take care of yourself, because as a woman, you have children, husband, co-workers, and so many people depending on you. So I think it's very, very important to make sure you take care of yourself as well. I'm gonna cut the video off now, and I'll continue once I have gotten completely dressed. And I'll see you on the other side. I'm back. Now I want to talk about the importance of getting your blood pressure checked. It's very important for you to get your blood pressure checked for two reasons. One of the most important reasons is if your blood pressure gets too high, it could lead to a stroke. And when a person have a stroke, that means oxygen isn't getting to the brain. So you want to make sure you manage it for that reason. And another reason is if you're not managing your blood pressure, it also could lead to blood clots in different parts of the body, whether it's in the leg, whether it's on the lungs, whether it's no matter where it's at. Because if it's on the lung, that's PE, which is pulmonary embolism. If it's in any other part of the body, it's called deep vein thrombosis. So you want to manage that. That's very important. Another thing I kind of want to talk about just for a brief moment is when you talk about diabetes, you can't talk about diabetes without talking about juvenile diabetes. I've met a lot of children that have diabetes, and having juvenile diabetes is as serious as having diabetes as an adult. So that's very important to manage as well. And if you're going to a health fair, make sure you take your kids or you take somebody else along that might need testing. And the best thing about this testing is the testing is free. So you don't have to pay for the testing. They'll send you your results in the mail. Last year, I was a participant. So I got my blood pressure checked, diabetes checked, my cholesterol checked. I had blood work done. I had everything every testing that was given out, I took as a precaution. Even though I see my medical team on a regular basis, it was nice to see students look at patients while they're learning how to treat patients, and I think that's very important. As a matter of fact, that's a part of my advocacy as well. I definitely want to be able to talk to students in social work, in nursing, going to medical school, or especially if they're going in the area of oncology, hematology, because if you're going into oncology, hematology, there's like a 99% chance that you're going to end up working with a sickle cell patient. And a lot of times students don't know how to work with sickle cell patients. And I know that's a narrative we're working on and we're changing as a community and as patients, because I'm on both sides. So I get to see the good and the bad, the ugly, everything that's all in the middle. Because as a patient, I see what they're doing. And then as an advocate, I see it from different perspectives. As an advocate, I see it when a male is going through it, when a child is going through it, when a mother that's pregnant with the child is going through it. Because I haven't experienced none of that. I don't have children. I'm not a male. I don't have a child. So it's interesting to see their perspective when I work with different people that have sickle cell or sickle cell related issues. And sometimes I work with patients that don't just have sickle cell. I work with patients that have diabetes. I work with patients that have heart disease because I have congestive heart failure. I have patients that have acute chest syndrome, pulmonary embolism, different types of ailments that sickle cell patients have as well. So I'm knowledgeable on those different types of health issues, and I work with patients with those type of health issues. So in conclusion of this video, if you're in the Albany area, make sure you stop by Albany State West Campus on October the 26th between 8 a.m. and 1:30 p.m. because they're having a women's health fair there. Make sure you get everything checked. Make sure everything is okay. And make sure you're managing your health well. And this year's theme is Take Charge. So I like that theme, so that's probably going to be the title of this video, Take Charge of Your Health, which is so important. And I want to leave you with this. Either your health is going to manage you or you're going to manage your health. As I bring this video to a close, I want to say thank you to all of my subscribers. For those of you who haven't subscribed, make sure you subscribe to SWGA Sickle Cell Awareness YouTube channel. Until next time, stay well.